Assalamu alaikum wa rahmatullahi wa barakatuh. I'm gonna talk about the mobile health applications in our course Health Informatics. And our objectives for this lecture is regarding the mobile health application or mHealth and mobile health applications definition and description of the mobile health systems architecture or the system itself and its components, and to identify the potential or possibility of mobile health applications in healthcare, how to apply this, and we are going to describe the challenges to the adoption of mobile health application that we may meet in our application in the future. So I'm going to introduce that National Institute of Health consensus group defined the mobile health or mHealth as the use of mobile wireless connection or wireless communication devices to improve the health outcomes, healthcare services, and the health research. يعني استخدام الموبايل wireless communication devices أو الأجهزة remote out of the health system, maybe by the healthcare providers, maybe by the researchers, maybe by the patients themselves. And this will affect on the improvement of health outcomes because it provides specific services like the health education, monitoring the patient case regarding the vital signs, the patient complaints. This is the tools that we can use with the telehealth, telemedicine, and telenursing, and it will help also for providing the healthcare services and the health research, as we will have raw data or complete data regarding all patients using these mobile health applications. And this is helpful for the researchers to conduct their researches and to gain an evidence-based practice. Typical mobile health devices or mHealth devices، يعني أنواعها بقى ال mHealth devices دي ممكن تكون زي إيه؟ ممكن تكون زي ال weight scales wireless communication device. Yes, it have. and glucometers أجهزة قياس السكر and wearable sensors. يعني إيه wearable sensors؟ يعني sensors يمكن إن إحنا نلبسها وإن هي to attach by the system to transfer the data automatically, maybe by the wireless, maybe by the Bluetooth, and this will fulfill the data inside the electronic medical record or the patient health records. Also to transmit the data wirelessly to the patient's smartphone or other mobile communication devices. كمان بتساعدني ال mHealth devices دي إن هي بتنقل الوايرلس information الموجودة على السمارت phone of the patient and to the other communication devices or other communication devices زي ما اتفقنا إن هي تفulfill in the electronic health record. Then I'm going to talk about the mobile health benefits. What benefit we can gain from using this mHealth applications in healthcare? It will provide a lot of benefits regarding the patients, healthcare providers, informed caregivers, and to the researchers. Firstly, I'm going to talk about the patients. What benefits does the patient will gain from applying this mHealth applications or mobile health apps? It will increase the access to the health information, yes, accurately, as each patient will have a remote device or a wireless communication device, and this will help in transferring the information and to fulfill the data of the patient in the electronic health records in the healthcare setting or in the hospital itself. Increase the quality of life. Yeah, it will affect on the quality of life as each patient will be monitored for their health, and they will gain the appropriate access to the service, and they will gain what they are need according to their condition regarding the diet, education, monitoring the case, monitoring the data and the vital signs, medication, regulation of daily life activities, and better diagnostics. Yeah, because there is mobile communication devices, which is wearable and which is wireless, can help. And there is a lot of mobile apps we're gonna talk about in this lecture, inshallah. It will help in providing a lot of information and help the medical physician in order to monitor the case and to take the appropriate decision regarding the diagnosis of the patient. Affordability or availability of this, and it can be applicable to all of the patients, and immediate feedback. Yeah, it provides immediate feedback to the patient regarding the all data regarding the health and the vital signs and the medication they are following. Also, it will help in improve the confidence in service, improve the confidence in the healthcare plan. It will provide confidence also and improve the confidence in the healthcare providers. They will trust the care that they are receiving. Promotion and encouragement of healthy lifestyle. Yes, because of continuous monitoring and continuous tracking through the cases, it will help in promotion and encouragement of the healthy lifestyle of the healthcare of the patients. Then, regarding the enhanced benefits of the healthcare providers or healthcare professionals, it will help in better diagnostic and treatment. These devices will help in that because each application is filled by a lot of abilities, a lot of skills, a lot of actions that will help in doing what we are need to provide the appropriate care. Also, it will help in monitoring of reaction to drugs and treatments. Yeah, regarding the patient reaction toward a specific type of medication, it will be accessed and it will be monitored by the healthcare provider. Instantaneous suggestions or immediate suggestions and advice to the patients. Yes. After the healthcare provider gaining data regarding the vital signs, regarding the medication effect on the patient, regarding the case condition, regarding the diet plan and the exercise plan of the patient, the physician will have an appropriate and a complete overview regarding the patient case, and it will help to use this information to make the appropriate interpretation, to take the appropriate decision making based on the available data, information, and the knowledge. Then regarding the health benefits toward the informal caregivers or نقدر نقول مثلا زي الهome caregivers or family members caregivers to the patient, it will help in remote monitoring. Yeah, I can do monitoring to the case remotely. مش لازم أكون مع البيشنت at the same place، ولكن إن أنا أقدر أعمل له remote monitoring من خلال this wireless communication device. And access to real-time and long-term trends of healthcare parameters. Yes, it will help to access the trends of healthcare parameters or the graphs and charts that الرسوم البيانية اللي شاملة الترند أو اتجاه الحالة بيتطور أو بيتحسن based on the plan that we are following، ولا في deterioration الكيس ولا في ثبات للحالة. تمام. طيب researchers actually هيستفيدوا ازاي من ال M-Health mobile applications significantly larger and more relevant databases of patient records. هيكون في فعليا data available عن كل الكيسز وكلها تبقى on the system and I can reach this data to do research عشان أقدر أطلع ب evidence based practices، أعرف plan of care اللي أنا مستخدماها كانت كويسة ولا not good. Then I'm gonna talk about the driving forces for M-Health. إيه الحاجات اللي بتخليني أو الفاكتورز اللي بتأفكت على إن أنا أتجه to using the M-Health mobile applications in healthcare in the future. دي one of the forces that affect on the change. لو نقدر نفتكر ال change theory that we are talked about, there is a driving forces and restraining forces. What are the driving forces for the new change to the mobile health applications in healthcare service? The first one, increasing healthcare expenditures. بوفر استهلاك الموارد المالية. ما يقارب ال 200 billion dollar could be saved by using the mHealth. The second one, aging population, elderly people, increasing lifespan expectancy. Yes. طبعا elderly people لو احنا caring to these cases remotely with using this new tech of mobile health applications, actually it will affect on their lifespan. Demographic peak of baby boomers. Who are the baby boomers؟ هم كثير الإنجاب. أنا أقدر أعمل لهم tracking عشان أقدر monitor their case in each pregnancy period. Then, rapid advances in an adoption of technology. How؟ نتيجة الادفانسز اللي موجودة في التكنولوجي حاليا in our world, we can use of mobile technologies is on the race. يعني استخدام الابليكيشنز دي حاجة دلوقتي on the trend. We are using the applications for everything in our life. Using applications for marketing, using application for buying and selling some issues, for communication, for education, for research, for everything. Electric sensors, power sources, and wearable materials are integrated into fabrics, polymers, and metals. يعني sensors والpower sources والwireless machine communication devices كلهم بيبقوا integrated مع بعض من خلال wires وطبقات وبوليمرز وmetals، ودي كلها can be used to reach to a complete data, a complete overview from all the aspects to gain the appropriate interpretation regarding the cases. So we can use these rapid advances in the technology in the mHealth application in the future. Regarding the mHealth systems for healthcare professionals and the researchers, there is 3 classes. We are going to talk about these clusters or these classifications. The first tier or the first classification, one or more wearable monitors to wear. ايه بقى الابليكيشنز دي؟ عندي one or more wearable monitors to monitor. wearable monitors أو wearable communication devices، ودي بتعمل إيه؟ بتوصل لي physiological signals أو vital signs، body posture type and level of physical activity. طبعا في برضو بعض الموبايل applications بتساعدني ان انا اعرف البيشنت position دلوقتي موجود ازاي، changing the position every what, type of position and the level of activity اللي البيشنت عملها دي. environmental condition surrounding the patient, the temperature, the humidity, and something like that. We will take an example regarding the ECG sensor for monitoring the heart activity. Yes, it will transfer the physiological signals. The TEL sensor for monitoring the trunk position. It will help in transferring the data about the trunk position لما يكون في bandage, electronic bandage أو wireless communication device connected على the trunk of the patient. It will transfer the data. And sensor providing information about humidity and temperature in the environment. Okay. Second classification of the mHealth systems. The mHealth applications on a personal communication device. Personal communication device. These apps, it will provide to interface to mHealth monitors to configure them and retrieve data periodically from them. يعني إيه؟ بيكون مع البيشنت communication devices at home and with the healthcare providers in the hospital on the electronic health system. في communication device بتعمل fulfilling to the data on the system. بتعمل إيه؟ configuration ما بين two way of communication, the patient remotely and the healthcare setting with the healthcare providers and the electronic health records, retrieving the data periodically from them. to obtain all the information adequately. زي ما نقدر نقول كده إن دايما بيبقى فيه refresh to the system ودايما updating the data from the two ways. The user to report the status and provide feedback and guidance. يعني إيه؟ لما دايما بيوصلني data regarding the physiologic data, the temperature, the position of the patient, the medication plan, على طول بيحصل إيه؟ feedback من healthcare provider after interpretation to the patient itself, to the patient him or herself. The medical services to upload feedback generated at the server. Yes. Medical server upload the status information زي ما قلنا من خلال إن أنا gaining this data will be transferred to information to make the appropriate knowledge understanding to the condition and then give feedback through the appropriate decision making what the patient is in. The third classification or third tier, the mHealth services as accessed via the internet. This will help in medical server to keep the electronic medical records of the registered users, yes, as it's connected automatically. Provide various services to the users, medical personnel and informal caregivers من خلال النتورك. دايما بيبقى فيه immediate feedback والنتوركينج بتعمل easily transferable with the data. Patients, healthcare professionals can access the data via the internet, yes, from anywhere. Collected data can also be used for knowledge discovery through data management system. Discovery to this data يعني إيه؟ يعني I can use this data من خلال management system of the data after collecting the appropriate information and collecting the appropriate data to do researches to help in monitoring this information and integrating this information with the other informations to take the appropriate decision. Here I'm going to talk about a mobile health system in action case study with a cardiac rehabilitation case. Peter is not following his prescribed exercise regimen at home after a heart attack, slowing his recovery. Case دي هي دلوقتي في البيت connected by the mHealth mobile apps, wireless communications. The mHealth monitoring system reading the data of the patient and said that more accurately records his exercise activity. إن البيشنت بيعمل exercise activity. Smartphone app can help in his exercise efforts. في عندي applications on the smartphone can help in monitoring the exercise efforts. Healthcare professionals can collect and review his data over the internet and make adjustments to his routine and treatment based on objective quantitative data. من خلال إن healthcare professionals connected via the internet with the patients through the wireless communication devices بيحصل عندي collection of the quantitative data ومن خلال quantitative data وخاصة إن quantitative data دي objective يعني مش أنا اللي شفته وقلت رأيي لا ده في جهاز معين هو اللي وصل لي الداتا دي ودي more accurate information than the subjective data ودي بتساعدني في finalize the decision of care to the patient and then it will help to reduce the office visits and decreasing healthcare costs. Using these mobile apps in this case will provide reducing the cost of healthcare service and reducing the cost of transferring the patient from the home to the healthcare setting and reducing the office hours with the healthcare providers. Then I'm going to talk about the mHealth applications itself. ايه بقى الابليكيشنز اللي متاحة ونقدر نستخدمها to maintain the telehealth, telemedicine and telenursing out of the healthcare setting itself. And this is the future focused oriented healthcare service we need to focus on إن شاء الله من خلال new trends ومن خلال الاتجاهات الحديثة من new generations to be graduated إن شاء الله. Medical reference. It will help in medical reference help users to find information related to a broad spectrum of medical topics. يعني أقدر أوصل to medical topics مهمة جدا، وهي تعتبر medical reference قوي جدا. بعض الابليكيشنز دي مثال عليها عندي البايو ديجيتال هيومن، عندي إيبوكيتس، وعندي الاب تو ديت. دول كلهم applications بيساعدوا ال healthcare professionals to gain or to find information related to broad spectrum of medical topics. طب أول واحد ده اللي هو البايو ديجيتال هيومن app. It provides detailed information and graphical illustrations of the human anatomy. طب الابليكيشن ده أي واحد منهم؟ هو ده شكل الابليكيشن. بايو ديجيتال ابليكيشن بيديني زي ما انتم شايفين complete information about the anatomy، وده مهم جدا ومفيد جدا للطلاب اللي بيدرسوا مثلا health assessment الاناتومي. This application is perfect in education. طيب the second mobile application Hippocrates, it will allow the reviewing of drug prescribing and safety information. يعني ايه؟ لما يجي الفيزيشن يعمل drug prescription لازم يعرف ايه الكومبوزيشن وايه بيتكون من ايه. ده الهيبوكراتس، مكونات الميديكيشن والسايد افكتس. والكلينيكال فارماسيست مثلا لو بيتشك لو في مثلا resistance ما بين two medications ممكن احتمالية يحصل medical error، فبيبتدي ان هو يقارن the effect of these two medications وياخد القرار if it's good or not من خلال using this Hippocrates. Also, the up-to-date mobile app, it provides synthesis of research evidence and recommendations for practice. يعني ايه؟ يعني خلال الابلكيشن ده بيبقى فيه evidence based practices وفيها recommendations بال best practice what to do in this case. And this is very important to do in managing the cases of patients. طيب ايه تاني mobile health apps regarding the patient education؟ يعني البيشنت يقدر يستخدمها for education. طيب educate the patient during interaction with the healthcare providers. يعني احنا healthcare providers we are conducting health education to the patient. Now we can use this app draw MD. It will help the healthcare providers to open and draw on anatomical images to explain procedures to the patients. Yes, this application helped to وطبعا الابلكيشن ده متخصص في منه طول الاورثو العظام، في منه to the endocrine، في منه to the gastrointestinal system. الابلكيشن ده بالذات في منه تقسيمات متخصصة according to the specialty itself اللي أنا محتاجة إن أنا أدخل وأشرح للبيشنت anatomically كده how to move, how to make exercise, how to make a specific massage, specific sitting area، الإفكت بتاعها على ال specific anatomical area in the patient body. ودي أنا بقدر استخدمها for education to the patients and also I can use it as an educational tool to the students. Regarding healthcare workflow management, healthcare providers can remotely access patients' historical health records, for sure, and current vitals and use them for pharmaceutical calculations. كويس جدا إن أنا أقدر أوصل للpatient historical data current vital signs complete overview about the case وأقدر أحسب pharmaceutical calculation من خلال Airstream patient monitoring mobile application. It provides real-time and historical access to the patient physiological data. هو ده الابليكيشن موبايل ابليكيشن اسمه Airstream patient monitoring، وده connected مع الهيلث كير providers electronic system ومن خلال monitoring to the patient vital signs. Now أقدر دلوقتي مع patient vital signs مع history of the case مع current sign and symptom أقدر to take the appropriate decision regarding the pharmaceutical description and pharmaceutical calculation. طيب regarding mobile health applications for consumers for the patients itself for the المستفيدين من الخدمة برعاية الصحة نقدر نقول ال patients or consumers. Most health related apps are dedicated to dedicated to health and wellness monitoring and management. يعني ايه؟ في بعض الابلكيشنز اتعملت to monitor the health and wellness of the patients. For example, my plate. My plate, this app is for what? Help users to keep track on their meals, exercise and weight, but relies on user input. طبعا أنا I should to make inputs أدخل data معينة as a consumer to gain my plate, my plan of diet. For example, يعني مثلا هنا أنا أقدر أقول إن أنا as a diabetic patient عايزة أعمل وجبات معينة بلان معينة للغذاء بتاعي. أو أنا بعمل دايت لازم أعمل انتري مثلا للويت والهايت والبادي ماس اندكس والايج والكلام ده كله والهابتس والاكسرسايزز، ومن خلالها بقدر lead diet plan I can do and I can follow. Then we have another app regarding the called Acupedio uses the smartphones to built-in sensors to access the number of steps that the user makes during his or her activity. ده برضو موبايل Acupedio ده عبارة عن موبايل ابلكيشن وبيشتغل as a sensor. لو أنا ماسكاه وبعمل walking مثلا بيكاونت الووكينج ده وبيقول لي أنا كام سعر حراري حرقته، الهارت ريت قد إيه، البulse قد إيه، البودي ماس اندكس، بيديني readings to the data and this data is attached to the health records of the patient itself patient himself. طيب عندي كمان challenges that can face the healthcare providers during the care provision. عندي human factors. the human factors هنا اللي ممكن تأثر لي as إن هو challenge أو حاجة ممكن تعوق عملية استخدام الموبايل health applications في ال healthcare service. human factor. إيه بقى human factor؟ necessary to employ user-centered design and quantify user satisfaction of wearable health monitoring systems for everyday use. يعني إيه؟ لازم يكون ال healthcare providers well trained على using ال wearable health monitoring systems and they can use it. وكمان يقدروا يعملوا متابعة to the user activity and monitoring to the user activity and satisfaction for everyday use remotely without any face-to-face communication. يعني لازم الناس professional well prepared معاهم ما يكفي من experience that they can use the wearable technology like the Google glasses, the watches, the glucometers and the mobile smartphones, and how they can connect this to the system and how they can interpret this to the system. وكل wearable device is indicated specific data to the patient زي ما احنا اتكلمنا على الموبايل apps زي ما قلنا. ودي صورة بتوضح mobile health challenges using the top wearable devices. This one, top wearable device, and this is composed of two-way communication. وفي من خلال two-way communication في هنا processes أو devices بتساعدني على نقل الانفورميشن دي. عندي البيشنت داتا بتجيلي من استخدام البيشنت to smartphone mobile apps, and these smartphone mobile apps and other devices which is connected to the system by Bluetooth or by wireless or USB like the glucometers and the work watch or Apple Watch and the Google Glass. It will transfer the data to the electronic health record and the healthcare providers can use this for data interpretation and completing the plan of care of the patient. Also, one challenge that we can meet, the reliability. The reliability of the data of the sensors and their communication network must provide continuous high-quality service. These sensors attached to the patient should be reliable and transfer the appropriate and accurate information to the system to be reliable أو تكون حقيقية. تمام؟ طيب. Another challenge, we are talking about the privacy, integrity, and confidentiality of information, and this is our focus in using the new advances and new technology in health informatics. The privacy must provide support of privacy and confidentiality at each level of the system. I should be careful while using this communication or wearable communication devices that it will be private to the patient data and it will be integrated يعني integrated إن هي تكون سليمة communicated keeping in mind the professional code of ethics of the health informatics, and to maintain the confidentiality of information that it should be accessed only by the assigned healthcare professional, not available to every person or every healthcare professional. The last challenge that I'm going to talk about is the FDA regulation or Food and Drug Administration Organization regulation, subset of mobile medical applications. يعني ايه؟ الموبايل applications اللي أنا أستخدمها it should be approved by the FDA. زي ما قلنا focus on apps that have traditionally been considered medical devices or affect on the performance or functionality of currently regulated medical device, limits the regularity reach based on intended use of mobile medical apps. Only a few medical health apps have FDA approval. طبعا دي organization monitoring the performance of the apps. If this mHealth application is not approved by the FDA, is not trusted app to be used. Then I will close my lecture by summarizing what we are talking about in this lecture. We talked about the definition of mHealth or mobile health applications. We talked about the mHealth systems architecture and the potential or possibility of mobile applications in healthcare and the most common challenges to the adoption of mHealth applications for the future. And we are gonna to answer this question with the discussion board questions that I will upload on the Blackboard. You should enter this, and this is your general understanding of the lecture and your new ideas to apply. How might mHealth apps help to change the delivery of health care in the future? ازاي بقى mHealth أو mobile health applications دي will to change ازاي هتساعد على تغيير مجال الرعاية الصحية أو تقديم الرعاية الصحية in the future in your country KSA. I need this to be answered and I will put on the discussion board with the other 3 questions in the lecture, and it should be answered as it will be graded inshallah. And thank you for your listening, and this is a thank you by all the languages. Good luck, and any answer you are welcome at any time. You can communicate with me at any time. Thank you, my dear students, and I will see you inshallah very soon. Goodbye.